Sometimes when I post a video dealing with some of the unhealthy aspects of our modern lifestyle, people will write in pointing out how we are living longer than people did in previous generations. So in this video, I want to talk a little bit about longevity statistics and some of the things that impact them. But first, I want to point out that the generation of the parents of the baby boomers is the last generation that can, on average, or could, on average, expect to live longer than their parents or their grandparents. And what is it that's killing baby boomers? Heart disease, cancer, diabetes, complications of obesity, just to name a few things. Degenerative diseases. There was a time, not too long ago, when doctors came to the patient. If a tree fell on you, you got run over by a wagon, you got kicked in the head by a horse, you had acute appendicitis or heart attack, what have you, the doctor came to you carrying a little satchel, and everything that he had in order to help you and try to save your life was in that little satchel. If you died because that horse kicked you, that affected longevity statistics. If a baby died at birth, that affected longevity statistics, and infant mortality was much higher then. Sanitation was poor in those days, and there were no antibiotics. A lot of people died from infections of different kinds, parasitic, viral, bacterial. Old people whose bodies were worn out simply died. But as time went on, things changed. There were more hospitals. There were ambulances. Then came paramedics, a 3-digit number that you can call for emergency services. There were medevac helicopters, lots of technology to save people's lives. But in spite of all these things now, longevity is declining. And it's because there is a difference between longevity statistics and health, the general health of the individual.